I have a friend that I met while I was doing business in Hawaii, and he told me he's actually a Medicare agent, and he said, "You know so much that I think you will do good if you become like me." Oh, you mean health insurance agent, broker? And he said, "Yes, because not so many understands it like you do. I mean, we learned it, but the way you understood it is that you can talk about how the claim was exactly paid by the code, that to the point that that because I was trying to tell him, he would tell me about issues with the payment of the doctors. And as a former doctor, I care that providers should be paid, So I see that big picture. But so I told him, well, usually the claim gets denied for a lot of reasons, incomplete information and all that. Sometimes you just have to go back and make the information complete. But at the same time, the way it is configured in the system, was there a wrong code? That's why you have appeal. You can ask about these things, and they can look at it, and they will realize, oh, it's just something is missing over here, and we can fix it. So he realizes I can do that as I help him resolve issues. And then I realized, okay, there is one skill that I never learned, that I realized it should have been, aside from finance, one of the skills that we should have learned even when we were young, and that was sales. But not because to sell just because, but we need to be able to, like, even when you're educating, you need to be able to sell an
Everything is a
idea,
sales. Even
right?
interviewing for a job, you're selling yourself.
Yes. So I realized that, and I had difficulty. There was a learning curve. I started this business 2021. I started as an independent agent, and the industry also is plagued with people who cannot be trusted because they're doing sales. And this is where I realized, well, I should approach teaching health literacy in a different way. But, I think I can do it if I become a health insurance broker and I focus only on health. And I tell people I don't do life because as a non-practicing physician, to me, it's all about health. If you have a healthy community, there's a lot of opportunity for them. If a lot of them are sick, and this happened during the pandemic, if everyone is sick, then you're not going to go somewhere. And so, I started to talk to people in a different way. I've seen people buy health insurance just to use it because they got sick. And I said, well, the plans that come out today, when I look at them, um, just by merely looking at them, you could tell that they were designed to keep people healthy. However, when you have a higher level of care required, you need something else. So it's basically looking at all these products